So you've got myself and you've got Jill Thompson from Manchester City Council. You've got Rupert Lawrence, who's got dual head on today because he's a non-executive board director for TSA as well, but he's also the lead at, it's not Worcestershire anymore, is it? Abaca 24. Amica 24. It was only launched last week, wasn't it, the new name, so apologies. So, okay. So we're going to do a tag team. We've also got, right at the very front, who are going to join in with myself throughout the presentation, we've got Gillian Austin, and we've got Samantha, who are our associate trainers who actually come out and deliver the training for you, okay? So give you a chance as well to get their views of what's actually delivered, and you can ask them some questions about what the structure of the training day looks like and anything else. Like I said, we just want it informal, so please ask away. So workforce development. What is workforce development? In terms of what does that mean? Is it just not training with a new name? Remember when personnel changed from personnel to HR and everything else, and we had all the different changes and different names. For me, it's the star symbolises the 5 key elements of workforce development and the transformation. So you've got the supply, you've got the upskilling, you've got the new roles, and you've got new ways of working in leadership. Workforce development investment should be aligned with these 5 key elements, if not all of them, at least some of them, to ensure appropriate use of your resources and establish a common understanding of shared workforce priorities. No, it's fine. I'll just keep twisting. It's good exercise. So why do we want to develop our workforce? If you think how far we've come, and in terms of how technology has actually broadened and gone on, I'm showing my age now, but my dad used to talk to me about Flash Gordon and how we used to watch Flash Gordon and how you could see the strings of the spaceship going across the sky. And then when I was small, I used to watch Star Trek and used to be mesmerised by these machines that you could put food in, press some numbers, and it came out cooked. How amazing is that? Who hasn't got a microwave? Do you know? They had these flip communicators that you could flip open and talk to. Who hasn't got a mobile phone? So in terms of how much the technology has moved on, how do we make sure that we're moving along with the times, we're moving along with the technology and everything that's coming and everything that's available? How do we make sure that we're developing our staff and giving them the skills and knowledge to be able to work with the tools that's available, that we're giving our service users the best possible service that we can using the technology that's available? Ken Olsen, famous words in terms of that. Nobody would want a computer in their own home. Do we know anybody that's not got a computer in their own home? Whether it be a laptop, a tablet, or anything. Most things now you can get computerised washing machines, computerised dishwashers, you name it, computerised lawnmowers. So that's what? 42 years ago? What are we going to have in 42 years from now? And it's planning for the future and making sure that workforce don't get left behind. We might, go at home and we invest quite a lot in smart TVs, the best light, phone that's available and everything else. Do we put the same time and investment in our workforce and developing them and making sure that the technology that we use at work in our workforce is exactly the same? Professional development can help us to ensure that you and your staff maintain and enhance the knowledge and skills needed to deliver professional service to your colleagues, customers and the community, enabling staff to advance in their careers and to move into new positions where you can lead, manage, influence and mentor others. Development can help to increase employees' confidence within the role. Investment in training and development helps to show employees that they're appreciated, which can help them to feel greater levels of satisfaction. And sometimes it's not always costly in terms of the workforce development. It could be mentoring, it could be shadowing, but you're still upskilling and making sure that you're developing their skills. Having strong and successful training strategies help to develop your employer brand and make your company a prime consideration for graduates on mid-career breaks and changes. Training can also make a company more attractive to potential new recruits who seek to improve their skills. The opportunities associated with these skills. Training can be any kind of relevant to work for responsibility of individuals and can be delivered by different appropriate methods. So on this next slide, I've just tried to capture some of the comments that we've had from some of the companies that have actually used us in terms of delivering workforce development. And as you can see, they're quite, and you can read it a bit small, I'll read some of them out to you. Identifying training developments and requirements, planning delivery and monitoring its effectiveness are business critical functions for us and is a key part of management teams' duties. Our comprehensive approach includes annual training matrix and delivery programme to ensure the needs of the service and our customers are being met and outcomes achieved. This is supplemented by a proactive quality management system that identifies training needs and improvement plans. That's just a couple of them. So these are just people that we've actually worked with and they've actually invested, and not necessarily financial, but invested in workforce development. I received the other day, it was from AIS, because we'd used AIS quite recently in terms of recruitment, their flyer about sort of what they're doing and what is happening global. And I found it really interesting that they're saying, and there was like across the United Kingdom, and it said key skills in demand. So basically they're finding it difficult to recruit in these areas. And some of them was around cyber security analysis. We've not been talking about data all the time we've been here at conference and what we're doing with the data. Part qualified accountants, site managers, data scientists, and Java developers. So in terms of you think of the tech industry, how them touch all those roles, there is a huge gap in terms of workforce development. There was another interesting article within it that I wanted just to point out. It was about robotics. And it basically was saying how many robots are actually being used across the UK. And so installed robots per 10,000 employees in 2016. So in the UK, for every 10,000 employees, 71 robots was installed. I actually thought it would have been higher in terms of that, because we're looking at a cyber world and a cyber of what we're doing in terms of robotics. So there's definitely that need for skills and upskilling our workforce. So what do we need to know? Technology-enabled care. It's not just about communication, but about prevention and enabling. If some of you came to the workshop prior in terms of what Manchester are doing, you'll see exactly what we're talking about in terms of that prevention. It's about independent living. It can be brought, you think of it, you think of tech and you talk about people about tech, they just vision the big red button, because that's what people see the tech is. We need to make sure that we're educating people in terms of workforce development, that it's a much wider aspect of it. Just like the microwave was thought of something used in the catering environment, we need to ensure that the staff have the right knowledge and skills for a modern technology world. We need to ensure we can provide a quality standard service. It used to be thought that by training and employing with better skills, they would be more likely to leave and take that investment with them. But that isn't necessarily the right way. Research shows that skills development and opportunity for professionals and personal growth are important aspects of employee retention. When an employee feels that their leadership skills are being valued and nurtured and nurtured, they are less likely to leave the company. There are two main benefits of the workforce development. The first is that it provides individuals with the opportunity to acquire knowledge, skills, and attitudes that result in improved workforce performance and gainful employment. The second benefit of the workforce development is that it provides employers with the effective method to communicate, share their skills for demand of what they're actually doing in terms of developing the business. said new mindsets, new results. Why do we need to do the training? There was once a time when only Newton and a handful of other scientists could comprehend the calculus of the classical mechanics. When Einstein published his paper on relativity, it was said that only 6 people in the world could understand him. These days, a typical teenager were well informed of all these topics. There was once a time when you used to go to the library, and I remember those days, to find a reference book on a topic you were researching. It could easily take you hours or days to find what you're looking for. These days, it's only a click away. There's a time that in order to learn how to place a veneer on a tooth, you'd have to go to dental school or attend a specialist course or someone physically show you. Now you can watch it on YouTube. So what I'm trying to get is, how are we moving along as quick with the times as everything else is? Everything's happening at such a fast pace. Are we putting this back into the workforce? Are we doing this back into the workforce development with our staff? So how, this is where my partners in crime join me, please, ladies. So what I want to say, TSA have built a range of face-to-face training packages, and I think most of you know in terms of we do the assessing for tech, the call handling, we do them in dementia training, we do the core competencies, we do quite a lot. But what I wanted to do is for Jill and Samantha to have that chance to explain to you what that actually looks like in terms of that landscape. What do they actually do on those training days? How is it delivered? What is some of the feedback they get? So I'm just going to hand over for just a couple of minutes and they can run through that.
Thank you. I'll go that way. That would be fun, wouldn't it, if we send Dawn flying on the floor. Can I just ask how many of you here have actually had training from us already? Thank you, guys, and it was a pleasure to deliver it too. If you're actually looking to buy in training, you're wanting to purchase in training, what is it that you're looking for from your training day for your staff? Somebody shout out. What do you want to give? Okay. Okay, so standard principles, yeah, that everybody can subscribe to. How would you feel if you tipped up for a training day and you sat there a bit like you are now, and it's just the whole day long, it's death by PowerPoint and you've spoken out? Is that effective kind of training? No. So what kind of training would you prefer your staff to have? Interactive, yeah. Get involved, yeah. Okay, that is kind of what we do, isn't it? It is. We've developed the training days that we deliver. They are based around standard packages, as John said, so there is a standard principle, because obviously they sit under the standards framework, so we know across the country there's some consistency, which gives our customers confidence. But the days themselves, we can tweak those days. They are designed to be very, very interactive, because we want obviously that buy-in. You've purchased training, you've invested in that, you want your teams to walk away from that day feeling they've learned something of value. They feel that they've actually been involved in that session, and that's what our days do. They're quite intensive days, aren't they? On any of the sessions, and we like to have optimum numbers 15 to 16 on a training course, so that we can get the group activities going, we can get people involved. We can go up to 20, but that starts to get a little bit, management around personalities and things like that, so maximum would be 20, at least 8. Which makes the group work, interactive and things like that. And throughout the day, there is a little bit of PowerPoint. We still have to have some of that, but we have activities, don't we, Sam?
We do, and share experiences, both our experiences. Sorry, can everybody hear me? I do have a big voice. Share our experiences from either the service provision or of the industry, or from going into different organisations, stories that have been shared with us, to make it personal. We keep talking about being person-centred. We try to deliver the training so that it's person-centred, and encouraging people to share their stories, because I think particularly for call handling, it's not one of those services where you can give somebody a Bible and say that's going to cover everything that you will come across in your role, because there's no 2 hours, there's no 2 days, there's exactly the same. But by sharing these experiences, then if somebody does have a call that's similar, then it does set off that bell on how to manage that call, which the feedback that we've had so far is, I did come across, funnily enough, within that week, a similar call, and having had the training, then it helped me deal with that call better, because I was more mindful of the service user or of the family member or whatever.
So we also use, as well as obviously Sam and I both have a background in the sector, and I think that's important when you're doing something as specific as what we do. We have a background in the sector, so we have understanding, so it's relatable. We can relate to the people that we are training. We like to develop case studies around your locality. So if we were coming out to deliver training to you, we might ask you, if it's assessing, what's your assessment processes? So we've got a good understanding of that, so we can seek the training in your practices and processes. We might like to develop our case studies around some of your success stories or issues, because again it's more relatable. So there are key points obviously that we need to get across through the training, but we try and make it as personal to your service as possible when we come out and deliver the training. So there's a lot of elements in it. They're very interactive, and so we've been delivering now for nearly 3 years with all the training sessions, and we generally get the feedback we get is interactive. We like to challenge. We challenge processes. We don't back away from a challenge, because at the end of the day, what we're trying to do is ensure that everybody feels confident in what they do, recognised for the skills that they've got, and that they're delivering their services in a safe and competent manner through the training. So that's just a little bit of a snapshot of a day in the life of our training. Is that all right?
Just one thing that I would like to add is I think sometimes when you think about training, it's more as a new starter within this industry. Then you do find that once you're in, then you don't really move out of it, whatever role that you're doing. So again, the feedback that we've had so far is even people that have been a call handler or worked in the industry for 10 plus years, they've still found it useful, because a lot of the time we can just firefight within our services, and you're trying to keep on top of things. So it's actually refreshing to come back and be reminded of what the standards are, and actually are we doing it? So start to question yourself, which the feedback, as I say, that we've had has been that people have liked that. So thank you.
Health and safety.
Thank you, ladies. Some of the other things that we've actually, if you can see on the actual slide there, some of the things that we're looking to do, we've already got the supporting people living with dementia. We do it over 2 days. Day one is more of an introduction of what tech, and we do build it on case studies in terms of working with people. Day two, and when we actually pull this together, it was supposed to be 1 day, but there was that much material to cover, there's no way it could have been done in 2 days, so it was split. It doesn't mean to say that you have to do the 2 days. I think it depends at what level you're working and who you're actually working with, whether day one or day two would be suitable. So day two, there's some prerequisite about doing some work before the training. So you actually bring case studies to day two with you. So it actually becomes a real life toolkit. So we work through as part of the actual case studies, the case studies that you bring to the actual training. So you're going away with other views and opinions of other your peers in terms of what they think, in terms of what they would do. And it's about challenging each other and looking at it. And it's not been written in isolation just with the TSA's view. All this has gone through the Alzheimer's Society, I've worked with Admiral Nurses, I've worked with the Dementia Alliance groups. So it's all been pulled together by working with us in collaboration doing that. Some of the other things we're looking to do, we're looking at recognised qualification, and I'll come on to that a little bit more. We spoke a lot to people today about the level 2 that we're rolling out, introduction to tech, and basically it's going to be based at the tech industry, but also health and social care. And it's an introduction, and at the moment in England, we're trying to work out how we get it in Wales and Scotland because it's different funding. But in England, as long as you're not already on an apprenticeship, it is a government-funded training course. So it's a level 2 qualification. This is the kind of things that TSA are trying to get involved in. So it's a level 2 training course. Okay, so if you want some more information on that after as well, we can go through that and how you register your interest in that. Okay, we've also been looking at Train the Trainer. We have actually got a Train the Trainer course ready to go live. We've just not decided yet of how we're going to pitch it and where we're going to sort of, because being a Train the Trainer, we need to make sure that you've got a refresher and make sure those skills are up to date and that kind of thing. So it's looking how we actually do that. And because we're doing a lot of work around pulling out the qualifications and making some of our training packages into qualifications, we've kind of put things on hold so we can get it at the right pitch. Because some of the messages we've been getting from our members is, if I'm going to invest in training, if I'm going to invest in workforce development and spend that money, I would rather do it in a qualification and give my staff and develop them in giving them a qualification to use in the future. So that's kind of where we are. So that's why we're holding fire for now. So yeah, sorry, time. Then move on. Thank you. So basically what we're doing in terms of, so we've got, obviously it says here, an increased demand of health and care system, digital technology plays a huge role in the transition of care, and that's what we've been doing a lot of work around the care and everything. So we've been working with NCFE and CASH to develop the level 2 qualification, and working with EdGIL as well at the university to roll out this qualification. But again, like I say, we can talk about that after. We mentioned before about these qualifications, and on the right you can see the actual pyramid, and what our TSA sort of ambition is to look at doing qualifications right up to say a level 7 where it becomes strategic and corporate. So we work at the level 1 in terms of introductions, we work in level 2 in terms of broadening that knowledge, level 3s in terms of the trusted assessors, and working up that pyramid so that we can give a portfolio of training. And that's not to say that TSA are going to be delivering all that and TSA are going to be doing all that. We want to work in partnership and work with some of the training providers that are already out there that can support us to deliver this and work with us to develop it. And that's basically our mission. That's where we're trying to take this. Some of the other things that we've been looking at is around virtual reality. I've been doing some work with Horsham and Wigan and some of the others who are actually using at the moment virtual reality in their services. So I've been looking with them, because what they're actually saying is anybody can actually start using the virtuality kit, and who's actually making sure that people have looked at the risks and the elements and anything else. So that's what we've been doing in terms of looking at that. We have been doing something around GPS systems, apps. Obviously, people have lots of apps, and so we're looking at things like that. We're working with Orca in terms of looking at how we can work with that. Wearable devices. We're doing a power of attorney. We've done one in Manchester, and we're looking to do one up in the North East, and we're trying to move that around. That came to life because when UCAS actually came to go through our accreditation as TSA, they spoke to some of the members in terms of asking them, you know, about power of attorney. If you took a call and somebody was asking about power of attorney, would you know what to say? Would you know which was legal and what you could give and what you couldn't? And the answer was no, they didn't have that information. So UCAS are actually saying to us, in terms of the respective members, you know, that's actually breaking the law, giving the wrong information. And they told us that we had a responsibility to make sure our members knew that they had to have that information. So we're trying to run these workshops again in terms of power of attorney. And in terms of the delivery of them, they're not done by our trainers. It is actually done by a qualified solicitor. So it's actually getting that legal perspective. So what we're trying to get the message about is, mind that gap. There's a huge gap between what is actually happening and the workforce now, and what the workforce should be doing, and the knowledge that they should have, and the skills, and how we get there, how we work together, how we develop that workforce development, and how we basically get that message across. We're doing quite a lot with work with skills for care as well, to actually get the message out to the healthcare professions, health and social care, about the digital inclusion and how we can, you know, embed that message to as many people as possible. So one of the things that play on words, and like, don't miss the buzz, because the digital switchover is happening, and if you don't move with it and move with and getting on board that digital switchover and embracing it, then you get left behind. And that's what we're trying to get across to the members and everything, that you need to move with it and embrace it. We was going to do some live in polls now, but just going to move on if that's okay, and we'll do some questions and answers after, if that's okay with everybody. Go and hand over to Jill. Thank you.
Thank you.
Yeah, if you want to push that far. Sorry.
Shuffle down.
Yeah.
Hope I'm keeping my modesty as I shuffle down. Thank you. So, hi everybody. My name's Jill Thompson. I'm from Manchester. Was brought up there, went to school there, worked there, play there, still there. I don't see anybody here from Manchester, but and you probably look all a bit younger than I do, but you probably remember the legend Tony Wilson, or Anthony Wilson, when he's changed his phases and his persona. And his mantra, which was famous in Manchester, was like, you know, we do things differently around here. But actually, you know, we've come to realise that that's not the right mantra anymore, particularly for the city council. And we're thinking about, actually, we need to do different things. And especially for us, it's around how do we manage the climate emergency, because there's massive impacts on our residents and people that live there. But also, across the council, we've got this analogue business model, but we're in a digital world, so we have to do different things. And so this is a big change in our thinking, and which obviously includes technology. So I work as part of the local care organisation in Manchester, which is a partnership of adult social care from the council and community health and primary care. So I'm going to talk very briefly, because I'm conscious we're running over a little bit, about our approach to developing a tech workforce. And then that's across the health and social care local care organisation, which obviously will take some time because it's a big workforce. So a tiny bit of information about Manchester, just so you've got some context other than it's always raining, which actually isn't true, but we've still got this legend of it being very damp. We've organised our city into 12 neighbourhoods to work as an integrated health and social care system. And with each of those 12 neighbourhoods, we've got a population of between 30 and 50,000 people. So the big areas with big populations with very, very diverse needs. At the moment, we've got about 4,000 people that are eligible for social care. But what we know is a lot of people do have needs, but they don't meet eligibility. And we know if we don't do more early intervention and prevention, they will soon become eligible for adult social care. So we know that's going to go up. In the local care organisation, there's just over 3,000 of us, so it is a big workforce. The local care organisation is going to grow, and that workforce is absolutely going to increase over time. So for us in Manchester, you've probably heard this all during yesterday and today in terms of, you know, where do we want to get to? You know, we want to increase the life expectancy of people. In Manchester, you generally die 10 years younger than anywhere else in the country. You know, that's got to change. So we want to improve the outcomes of people for Manchester, with people in Manchester. You've heard again about the pressures of budgets in local authorities in particular, and in the health sector. We need to be able to manage our budget. That means managing demand. That means working in a different way. That means doing things differently, or doing different things. Yeah, slipped up already. And again, probably like the rest of the country, you know, we need to stop people going to hospital unnecessarily. You know, so again, linked to early intervention prevention, let's stop people getting into that system where it costs a lot of money and they probably get more unwell being in hospital, which is just what has happened to my mother at the moment. And latterly, and importantly as well, is about reducing our carbon footprint. It's a very big part of our vision in Manchester. On a positive note, we've got a lot of investment in Manchester around technology. So that's really, really positive. We've got capital monies that we've got from the council. We've got money from the Greater Manchester Transformation Fund, about 400k. We've got money from Innovate UK, just over $500,000. And we actually use some of our adult social care revenue budget too. So we've got quite a lot of strands of money to support developing technology in Manchester. And of course, we're always looking for more. We spend a lot of time writing bids, trying to get DOSH. So this slide, it's too small to see, I'm sure, at the back, and it's too detailed to explain. But what I'm trying to demonstrate just with this picture here is that tech has got to be part of a wider strategic workforce strategy. It can't be sitting on its own technology. It's integral to all of our strategic workforce planning. And this is a little bit more detail about our tech strand of our strategic workforce planning. We've got a phased approach, and I'll explain that more in the next 2 slides. Yeah. So for us, where do we start? We started with our senior leaders. You know, I've already described the changes that we need to make, you know, and those drivers around, you know, higher demand, not enough money, wanting to improve outcomes, needing to work in different ways, integrating health and social care. Those are all the drivers, you know, and you can see how they're linked to technology in the new world. And working with and through our senior leaders, and that's not just in the City Council, it's the local care organisation executive, it's the commissioning, joint commissioning in Manchester, it's the hospital trust, you know, working across all of those strategic systems, which are all held together by our locality plan. You know, this has helped us to drive forward this tech agenda. We couldn't do this just sitting in adult social care on our own. This has to be a system-wide supported direction of travel. So it's really owned at the top, this direction of travel around maximising technology, not just in the care world, but the whole of our business model. And of course, we really rely on our senior managers and leaders to keep that message going, you know, so we rely on them to support us with that messaging and, you know, promoting it and talking about it a lot, because, you know, things can often just slip off the end of the agenda. So we work very closely with our senior leadership team to support us in those really positive messages about the changes that we're doing. I don't know if people have heard about our Manchester. Is that anything that anybody's familiar with? No. Well, this is something that started a few years ago. It was one of the biggest consultations we've ever done in the city. And it wasn't just with citizens, it was with all the public bodies, it was with the private sector, it was with the volunteer sector, trying to find out, you know, what is it we want Manchester to be like in the future, and what do we need to do collectively to help us to get there. And from that, we developed our Manchester strategy and behaviours. And they are working together and trusting each other, which is absolutely imperative, not just with partners, but how we have our relationship with people that live in Manchester. Taking time to listen and understand, because it's so easy to jump to a conclusion, but taking that time is so important, and actually hearing what someone is telling us. Owning it and not being afraid to try new things, and definitely we've tried lots of new things in the world of technology and our workforce, and we're still doing that. And being proud and passionate about Manchester, which, you know, it's a given if you're a Mancunian. So after we'd got that strategic macro commitment to moving forward, we started to think about our operational journey. And that's been much more of a bottom-up approach, working with our workforce, working with people that live in Manchester. And we've done a lot of co-designing or working with residents to see what is that they need, how could we deliver that, and with staff too. And we've got our group of staff that were called activators, which is something that they wanted to call themselves. And it came from a bad place, really. What staff were telling us was, it's pretty bad working in adult social care at the moment. The systems are rubbish, the processes slow things down, we've not got enough autonomy, you know, everything is not going really, really well. So using the Our Manchester, you know, listening, we had lots of conversations with our staff about what could we do differently and help us to do that. And a group of staff put their hand up to say, we want to be at the heart of moving forward and helping us shape the future. And so one of the groups of activators are our tech champions, who help us to keep our feet on the ground, but they often come up with the solutions for what could be different and how we could get there. So it really is a bottom-up approach, and it takes longer, but you absolutely is the right thing to do. We also made quite a lot of practical changes to support our new world of technology, tech, looking at our IT system for our electronic records. So what can we do in the system that can either monitor or record or prompt those conversations around technology. We developed a strength-based assessments and conversations with citizens And that's affected how people have had conversations, not just about assessing someone's needs, but thinking maybe could tech meet some of those assessed needs or not. But having those skills to have a strength-based conversation is enable more people to access tech because our approach is different. So as part of our getting our staff ready, we work with TSA to develop that tech awareness training, and we worked with Gillian and Dawn, and we designed something that built in the Manchester context, so the Our Manchester behaviours, the case studies of people that live in Manchester, all of that thing that made people connect to the training, because this is where they work and these are the people that they work with. And we tested it for 2 days, and then we had a bit of a review. We got feedback from the staff that had been on the training, and then we made some tweaks, because it's never right first time. Life's not like that. And then we made some adaptations, and then we did it for 3 days after that. And it's absolutely, a fantastic course that really meets the needs of our staff in Manchester around awareness for technology, and the feedback is absolutely excellent. And I've sat in some of them myself, and it's brilliant. And I think we got there because we did that together with staff and with the staff, TSA as a provider. It was a partnership to get something that we all needed. Also, we've got one of our ADs, assistant directors and adult social care as the senior leader for technology. So again, keeping that messaging, that responsibility, that accountability for making this work at a very senior level, that's really helped us make sure that we stick to plan. And tech, it's through everything that we do. I mentioned before our workforce strategy, tech is part of that. We've got improvement plans, tech's all the way through that. Our transition plans as we move from A to B, tech is embedded in all of that. So it can't be seen as something that sits over there on the side. It has to be embedded in the way that you work and the way that you do things. And all those things there have helped us have the right conditions, to move forward with our new way of working. So making it real, I just mentioned before, we've got lots of plans. The important thing is, keeping an eye on those, making sure that they're being progressed, monitoring them, not just putting them on a shelf once they're done. They have to be live, they have to be reviewed regularly. It certainly has made a big difference to, and even will make more difference in the future because we're still at an early stage, about the roles that we have across the council. And one example is the role of our contact officers at the front door. One about having strength-based conversations with people that contact us, but also about their knowledge about tech being a solution and be able to have that conversation. So we'll be doing retraining with lots of people where we recognise that their roles will change, and it won't just be people on the contact of centres. Our social workers, other people in health that do assessments of people's health and social care needs. People in our organisation that monitor and respond to when tech goes off. This is going to be affecting how they work. Our performance research intelligence, what do we need to collect? What performance data do we need in the future? All aspects of our business in the council is being affected by, embedding technology in the way that we work in the future. As part of demonstrating sort of return on investment and evidence that using tech makes a difference, we're doing a lot of financial modelling. So if X, Z, Y and Z is provided, it could save A, B and C or not, or it could reduce cost avoidance for new customers that don't have existing packages of care. So we need to also think about the money side as well as the outcomes, which are the most important things for our residents. And then finally, and we're not there yet because it's a phased approach. Our phase 4, embedding, this is business as usual. We've set up a mainstreaming tech board, which has all the senior officers across adult social care and health, making sure that we stay on track. We've got our tech champions who are our communities of practice, so they're out on the field, in the front line, hearing what's going well, getting new case studies from people that have benefited from tech, supporting their colleagues who might feel a little bit wobbly about working in a different way. So this is really helped us to support our staff, you know, in other ways other than training. And we've been working with TSA and other partners in developing the level 2 tech qualification. And again, you know, me going to meetings with Dawn and other colleagues, then going back to our staff and going, what does this look like? What does this feel like? Then feeding back, you know. So it's been great that Manchester has been part of the development of that level 2 qualification, and we're looking forward to testing it very, very soon. You'll be glad to go. That's the last slide now. Excuse me. So all that's here is just some examples, some visual examples of, you know, what we're trying to do here. So on the bottom left, you can see people wearing the virtual reality goggles. And this is one of our approach to our training. So it's not all classroom based, but people can be immersed in a situation, in a scenario, to help them think about their behaviours, you know, how they respond to things, and maybe think about doing things in a different way. And the feedback's been really positive about that. And that helps them with different conversations with residents and with colleagues. On the right of the picture, that's a group of some of our tech champions that are working on stuff. I mean, what they've helped us to do, and this is what, because they said what they wanted, they've developed brochures for staff and for people that work with us. They've developed posters to go in the office as a little reminder. They've developed checklists, simple steps for staff to use as a guide. So these have all come from our staff saying, this is what we need. And I've worked with them and say, well, help us to design them, help us to make them. And this is why... you know, bottom up, you always get the best solution if it's bottom up, in my experience. And then the top one, that was an activity with some residents, you know, where we're asking them about their needs and how perhaps technology could be used. So just trying to make it a little bit more real. So, yeah, I think we feel confident that we've developed a robust plan to embed tech across the workforce. And I think it's going to be a long journey because we're a very big workforce, but I think it's going to be a really exciting journey, and I'm glad that we're doing that in partnership, you know, because we can't do things on our own. Thank you. I'll get down now, if I can.
Carefully.
Yeah.
Thanks.
Oh, sorry, you need that.
Yeah.
Sorry.
So I've got the last presentation in the last breakout session. Gee, thanks TSA. I think we kind of heard two elements around workforce development. We've heard about training, and we've heard about you know, a strategy really for developing the workforce. But I think that what I wanted to talk about is how workforce development is actually done within my service and within my organisation every day, and it's pretty much all day, every day, and it's absolutely critical to the way that we deliver our service. It's probably the most important thing that we do. I've actually got to go to a board meeting tonight, so the pain for me doesn't stop at the end of this. After last night, I've got to go and do another few hours talking to board members about what's happening with my business, and I've got to talk about our risk register, and I've actually got a couple of risks around workforce development and training and the effects on quality and things, and it maybe just points towards how embedded it is at our organisation. So we are Amica 24 as of last week. We used to be known as Worcestershire Telecare. One of the reasons why we rebranded is probably because of our workforce development and the development of our service in particular, trying to embed technology-enabled care, trying to be a disruptor, you know, trying to change the way that tech's commissioned and used, and bringing it to a situation where it's at scale. And some of the focus of this conference over the last 2 days has been around care, and one of the ways that we've been able to kind of embed tech has been not just with the technology but the service wraparound, and how a caring approach really does then maximise the benefits of tech. So a little bit about us, you know, we are looking after a good amount of people across the UK. One of the reasons why we changed our brand was because we're not just Worcestershire, we're a national provider, but we do a lot. We actually are operating a number of different services. There's some other things that don't even make the cut on that list there. We even do reception services, we do Internet of Things type services and consultancy and things like that as well. But really, to embed technology-enabled care, we've changed the focus of our service. It's very much not based on the traditional telecare model of dealing with just inbound calls. We've very much turned that round, involved re-evaluation and a lot of proactive outbound calls to maximise the success of technology solutions. And to do that, we needed to make sure that our workforce understood about that and what our strategy involved. So we place a large emphasis. And one thing there, which is the Eden alternative, which is something that came across from the States, has been a massive influence on our service. It's a person-centered care approach that was designed for care homes, but we've actually applied it to a technology-enabled care provider, a telecare monitoring centre, which is quite unique. And I'll go into a bit more about that as we go along, but it's very much about combating loneliness, helplessness and worthlessness. And it involves empowering staff and things to be able to do that, and that's been a huge influence on our service. Just some of the results of that, and we've seen it over the last few years. I've been there 4 years now, and when I took over at the service, it was not in a good place, and it was a very, very straightforward service. And what we've done is just really try to embed that customer service approach and that caring approach, and it's had a really, really positive influence on our service. And there's an embedded culture now of workforce development and an embedded culture of being care focused, and I think that comes out when people talk to my team and things. So I'm really proud of that. We've got really good customer satisfaction ratings, and those are just a couple of headline figures. When you start to draw down on some of the detail and actually look at the individual pieces of feedback from service users and their families, etc., it really does then bear out what the service is actually doing. It starts with recruitment. We've done a lot of work around this, and I'm not going to teach anybody to suck eggs, I think, around some of the things I'm going to cover today. We do some things particularly well, I think, and we've innovated around some of the kind of standard things that you need to be doing around your workforce. But, just having really, really good, challenging tests when you're recruiting people and finding out what they're going to do in a certain situation is absolutely critical. So we've, given practical tests to installers and done role play scenarios and things like that. We've done the same with operators, but management positions, testing someone's leadership around tech and how they can portray the right message as well. That's been absolutely critical to what we've done. The sensible things like look at the backgrounds of where you're recruiting from and things, but don't underestimate the transferable skills. Do recruit from different industries and backgrounds. I never recruit on experience. I must admit that. I always recruit on what someone's capacity, capability is, and I think that's always really important. An induction, yes, it is just the start, but it's really, really important. We do a lot of onboarding, trying to get the person prepared for when they actually start with the organisation. That's something that we've really worked on over the last year or so. We've always had, a detailed approach to induction, and it's increasingly competency linked, and I think that's really going to come through with QSF, and as QSF develops over time as well. Really being about competencies and can people actually do the role, but we've actually done a lot of onboarding with employees coming into the organisation, so they understand what tech's about, but they also understand our person-centred care culture as well. We mentioned competency. We are really placing a large emphasis on that. We've just done the monitoring, the call handling training provided by TSA, and we've just done the assessor training, and we've applied that across different roles as well. We've applied that at management level roles. But also office-based staff that are just dealing with telephone inquiries around people purchasing tech, and but right through to actual tech assessors and installation operatives. So we're just expanding people's knowledge around that whole tech subject. We've got competency frameworks for every single role that's within our workforce, and we've got quite a few roles because we're such a diverse service. But that's really been a huge benefit for our business. And the one thing that we've done is really focus on how can you demonstrate that someone's competent, or how have they demonstrated the individual competency, and when and where have they done that, and then that gives you the basis to help manage performance and look at what training that individual needs. And it's linked to continuous improvement. We look at this all of the time, but we look at this at regular intervals as well. So when my managers are devising their service improvement plans every year, a big part of this is workforce development. It's around training. What training do we need to actually achieve what we're trying to do with the service and where we're going? It's not just what we have now. It's what are we going to be doing next year? And how do we get there? And I think that's a really key message that we always talk about as a management team. So we talked about all of the roles having a competency framework. We also have a matrix for all of the roles around their training and development, and it doesn't just cover the standard things like have they got safeguarding training, have they got data protection training. We say, right, okay, what would we like them to do next year? What do we think would be a good area for them to have development in and training? And that comes from feedback that they've provided, but it also comes from planning of within our services as well. So looking at the nice to haves as well. Obviously it depends what budget you've got as well, but yeah. And this has been really critical. I mentioned the Eden alternative, workforce development happens every day, as I mentioned, and you have to make sure that your staff are, or colleagues, as I prefer to call them. I hate the word staff, but having that buy-in and having that commitment and the freedom to engage with service users. We do some really interesting things around life details for customers. So we don't just take the standard information around emergency contacts and medical details and access arrangements to the property. We take what we call life details. These are things like, what did the person do as a job? When they were working, are they still working? What are their hobbies? What are their interests? What are their pets? And what are their pets' names? And lots of different things. And asking really, what do people actually want to tell us about themselves? So we can then make a better connection with that person. And we found that really, really effective in being able to build relationships between our staff and the service user. And that's actually created a better level of service. And our workforce is so much happier because of that. They get a real kick out of the service that they're providing, and it actually is a snowball effect and actually creates better quality all the time. Final point really is just involve people, involve your customers. Feedback is absolutely critical, and you should use that to inform your workforce development. But the biggest thing that we've done recently is using feedback from colleague surveys. We have that every year, and we picked up some things around our training that we needed to change, and that's really, really important that you do that. You know, take that step back and formally review what you do every year, I think is really important, and use colleague feedback within that. Thank you.
Thanks, Jill. Thanks, Rupert. So I hope you found that informative. We've got a roaming mic at the back, John. If anybody's got any questions, if anybody wants to ask anything from any one of us, then please do so. Deadly silence. Everybody's had a long day. Well, that's it then. I just want to say thank you for bearing with us, and thank you for actually coming to attend this session, because I know it's the last session of the day. And thank you very much for your time, and I hope you got some really good, useful information from that. Thanks very much.